Okay, to carry on, we will talk about component of medical management. Medical management generally include activity restriction, pain management, treatment of retention incontinence, or what I say is managed urinary retention. Why that happens is because when they have thoracolumbar disc herniation, they can oftentimes not able to, one, send in the push signals to the bladder so they can push and help them go to the bathroom. And two, they can also have a very tense muscle in the lower body, and sometimes can lock the urethra really, really tight and makes them hard to push over. So you do have to manage them. Um, the public recommendation in terms of like the size and the duration of cage restriction, like how big is too big and how small is too small, is really variable. Generally speaking, what I tell people is like, hey, find a space that the dog is not too stressed and trying to come out all the time, and where they are mostly sitting in a normal posture and without trying to do too much. That's probably a good healthy mediums. The 4 weeks of recommendation is somewhat kind of using a common sense, but there's a lack of critical literature to really support that 4 weeks is always necessary. This 4 weeks plus 1 day makes a significant difference, or 3 weeks. Can 3 weeks be enough? But generally speaking, once the disc herniates, the outside part of the disc takes about 2 to 3 weeks to heal over. So in my opinion, it's probably safer to keep them confined a little bit longer so that they don't have ongoing disc herniation. That's what I would do and share with my clients. It probably is a little bit overkill, but generally speaking, I've seen a pretty good outcomes in that. In terms of using what kind of pain medication you use, there are generally two types of neurologists. First type of neurologists usually like to use the steroid. It's a little bit more older school that the steroid was a little bit more described earlier, but then the newer time, the newer literature kind of is in more favor of using the non-steroidal anti-inflammatory drugs. There may be some benefit of steroid that can benefit some cases with ongoing spinal pain, potentially related to epidural inflammation. So on the surface of the spine, could be having some inflammation and cause the source of pains. The other branch of the neurologist would use non-steroidal anti-inflammatory drugs. So those are the drugs that is like carprofen, meloxicam, um, or Rimadyl. They're just to name a few. Usually we see them don't need to have them very long time. Usually 5 to 7 days, usually enough. Requirement for pain medication beyond this time point, despite appropriate activity restrictions, should be considered as a possible indication for further investigation and potentially surgical management. If the dog just cannot be comfortable without medication, that kind of indicates that maybe there's just a large amount of disc that it hurts them every time they move. It's probably helpful to remove them, regardless of their neurological status. And unfortunately, we don't know whether or not that's going to be the case, right? We don't know if the dog is ongoing being in pain unless we're several days in the medical management. So, but that's another consideration to have. What is probably in agreement with all the neurologists or all the veterinarians is that use of concurrent corticosteroid or multiple non-steroidal anti-inflammatory drugs is probably not a good decision. Why? Because it basically creates a lot of GI problems. They puke a lot, they diarrhea a lot, and when the dog's already not moving, combined with the diarrhea, you can see it kind of creates a very messy situation. There are additional analgesics, so your NSAIDs or steroid combined with some gabapentin, diazepam, or methocarbamol. So gabapentin is a neuropathic pain medication when the nerve is injured. They usually are pretty helpful to kind of modulate the pain signals. The muscle relaxant, the diazepam, or methocarbamol usually are helpful to relax the urethral muscles, so it makes it easier for them to go to the bathroom. Some cases will require some opioid, depends on each individual situations, but usually don't need them for a very long time. There are some additional description talking about acupuncture and rehabilitations. So far, it has a substantially variability in terms of how you describe the method and how do you measure the success. we probably know basic rehabilitation exercises such as standing, just standing exercise, flexing and extending the joints are probably good enough, but it's hard to make a more precise scientific recommendation in addition to that. So, does underwindow treadmill is a very necessary component of medical management, how long I have to do this and how many sessions and how intensive I need to do this, how high the water needs to flow or how fast it needs to flow is somewhat currently undiscovered. We're having we don't have agreement quite yet. But I think it is a helpful information to start about, like these are generally the component with additional add-on on some certain patients that people would like to try. I think this is also important. Um, if the dog is getting to the point that, hey, it's really not walking, the treatment of acupuncture with physical therapy is really not recommended to surgical management. So if there is an indication of surgery, that's probably going to be helpful. Um, keep doing the more and more rehab probably is not very, helping the case. Then the next chapter they get into talked about the surgical management of the disc herniation, which will be a different topic.